السلام عليكم ورحمة الله وبركاته. رمضان كريم، تقبل الله صيامكم وأعمالكم. صف ثالث. Our lecture today about calcium metabolism disorders. What about calcium hemostasis? You know, blood calcium regulated by a lot of mechanisms, and the main mechanism is the site of absorption of the calcium, which is the small intestine, and the storage in the bone, and the kidney hormone, which have a major role in calcium hemostasis. So calcium absorption in the blood by the presence of active form of vitamin D, which need to be activated in the kidney by 25 hydroxycholecalciferol in the liver, and 1 in the kidney, and the active form is 125 dihydroxycholecalciferol, which is responsible for calcium hemostasis. In the bone, about 1000 grams of calcium stored in the bone. Bone resorption, bone deposition is essential for calcium hemostasis. Calcium in the diet, the main source of calcium is dairy product, and also calcium depends on vitamin D on its absorption. The vitamin D main source is the sunlight. Secretion mainly in the urine and feces, and as I said, storage in the bone. So we have bone formation, osteoblast, responsible for collagen matrix synthesis, calcium phosphate, crystalloid form, surrounded by bone, become osteocyte. Osteoclast, which is responsible for bone resorption, change local pH, causing release of calcium and phosphate to dissolve in crystals into the intracellular fluid. So this is bone resorption, this is osteoclast as you notice here, and this is osteoblast. يعني الخلايا اللي تبني العظم والخلايا اللي تهدم، اكو بالانس بيناتها حتى لا وحدة تتغلب على الثانية. What is calcium? It is a mineral that is essential for bone health, cardiovascular health, muscle maintenance, circulatory health, and blood clotting. It is essential in clotting system. Calcium also acts as an enzyme activator. It is essential for a lot of metabolism in the body. It is available, as I said, in green leafy vegetables, seafood, almond, milk, and its product. Body requirement, as you notice, by aging, increased body requirement from the age from age 1 to 3, 500, age 51, 1500. Pregnant and lactating lady need about 1000 milligram. We have different form of calcium. Calcium in the plasma, 45% ionized form, which is active form, 45% protein bound, albumin mainly, and 10% complex with anion, calcium citrate, sulfate, and phosphate. So to estimate ionized calcium, we have this calculation: corrected calcium, measured calcium, plus 0.8 multiply 4 minus albumin. This is the ionized calcium, how you calculate it. Regulatory factor, parathyroid hormone, and 125 dihydroxycholecalciferol, which is active form of vitamin D in the gut, kidney, and bone. Calcium receptor are mainly in the parathyroid gland, kidney, brain, and other organ. Vitamin D, active form of vitamin D, 125 dihydroxycholecalciferol. Its production in the kidney catalyzed by 1-hydroxylase. 1-hydroxylase activity is increased whenever there is decreased serum calcium, increased parathyroid hormone, or decreased serum phosphate. Action of 125 dihydroxycholecalciferol, calcitrol, increase intestinal absorption of calcium, increase intestinal phosphate absorption, increase renal absorption, and increase bone resorption. As you know, we have 4 parathyroid glands, 4, 2 up and 2 down in the posterior part of the thyroid gland. It is secreted from the chief cell of the parathyroid gland. Function: increased renal absorption, increased renal phosphate excretion, and increase plasma calcium by increase osteoclast activity, intestinal absorption, synthesis of 1,25-dihydroxycholecalciferol, and increase renal tubular absorption. So regulation of parathyroid hormone, low calcium, increase parathyroid hormone, high calcium, decrease parathyroid hormone. Calcitonin, which is hormone produced by thyroid C cell, it is function inhibit osteoclast bone resorption, increase the renal excretion of calcium, and what is the stimulate for its secretion till now it is not well known. So calcium hemostasis, this is bone, site of bone storage of calcium, parathyroid gland, thyroid gland. So there is usually balance between blood calcium and the function of these organs, which are essential for calcium hemostasis. Function of calcium, as I mentioned before, muscle contraction, signal transmission, body structure, and coagulation cascade. Deficiency of calcium can cause rickets in pediatric age group, adult osteomalacia, and osteoporosis. What is rickets? It is softening of the bone in children and main leading cause of fracture. It is main cause is vitamin D deficiency. What is osteomalacia? It is a qualitative defect in the bone, the softening of the bone due to defect in the bone mineralization. It may be show sign of diffuse bone pain and bone become fragile. A common cause of osteomalacia is malabsorption syndrome or vitamin deficiency. Can be seen in patients with operation on the small intestine, removal of small intestine, or those with celiac disease. What about osteoporosis? Characterized, it is a quantitative defect. It is decreased low bone mass and structure, deterioration of bone tissue, leading to bone fragile and increased risk of fracture. Osteoporosis, men as well as women are affected by osteoporosis. Women have high rates to be affected by osteoporosis, especially in the post-menopausal period. And the common example for osteoporosis is part of aging and those patients using steroid. Calcium metabolism, we have three disorders: hypercalcemia, hypocalcemia, hyperparathyroidism. Hypercalcemia, condition in which calcium level is above the normal. The main cause is overactivity of the parathyroid gland. Cancer and some medication may cause hypercalcemia. Among all causes of hypercalcemia, hyperparathyroidism and malignancy are the most important two causes. Investigation established calcium is elevated, real check, ionized calcium, measure parathyroid hormone, 25-hydroxycalciferol, vitamin D, parathyroid hormone related peptide, and this is secreted from a malignant cell as part of paraneoplastic manifestation, T4 ACE as appropriate. This is seen in patients with angiotensin converting enzyme, increase in patient with sarcoidosis. Radiological investigation, basic. We look for hands, kidney, urinary bladder, ureter bladder, and chest X-ray and localization. And as you know, this is the osteoporotic lesion in patient with hypercalcemia. Etiology, increase GIT absorption, unlikely, decrease urinary excretion, thiazide, increase loss of bone, elevated parathyroid, more common, hyperparathyroidism, malignancy, more common. So these two are more common cause of hypercalcemia and osteolytic metastasis. Regarding treatment for hypercalcemia, as you know hypercalcemia causing acute confusional state, polyuria, polydipsia, so the patient dehydrated. So the main line of treatment is rehydration with normal saline, and also we can use steroid, have anti-osteoclast activity, dexamethasone, and also diuretics, furosemide, have a role in excrete excess calcium. In case of malignancy, biphosphonate or zoledronic acid is anti-osteoclast activity is drug of choice in case of malignancy. Whenever the cause is hyperparathyroidism, so surgery is the definitive treatment. Hypocalcemia, calcium below normal, ionized calcium, low level of parathyroid, low level magnesium and vitamin D deficiency. Among all other causes of hypocalcemia, post-surgical, this is very important. Post-surgical hypoparathyroidism, post-surgical for what? For thyroid gland, autoimmune hypoparathyroidism, and vitamin deficiency. These are the main causes of hypocalcemia. Decreased absorption, poor dietary intake, increased excretion, decreased bone resorption, low parathyroid hormone resistant, and vitamin D deficiency. So low parathyroid, hypoparathyroidism, genetic disorder, autoimmune diseases, could be polyglandular diseases, isolated hypoparathyroidism, infiltrative disease of the parathyroid gland, radiation-induced, Hungary bone syndrome, post-parathyroidectomy. Post-parathyroidectomy, there will be more loss of calcium, or more use of calcium by the bone, and this can cause hypocalcemia because most of the calcium move to the bone for storage. HIV patient, high parathyroid hormone, vitamin D resistant, parathyroid hormone resistant, pseudo hypoparathyroidism, hypomagnesemia, renal diseases, and loss of calcium from the circulation, tumor lysis syndrome, and hyperphosphatemia. Two signs, clinical signs, are Chvostek sign and Trozius sign. Trozius sign تخلي الكف مال البلد بريشر، نقيس الضغط، هنقول ضغط 12/8، نوقف المانوميتر على 12 وننتظر فد few minutes. راح شو يصير؟ راح يصير عندنا كاربوبيدل سبازم، كاربو هاندز بيدل فوت، نفس السبازم اللي نشوفه هنا نشوفه بالفوت. And this is because of movement of calcium to the intracellular fluid, cause of local tissue ischemia due to pressure of the cuff. So this sign and this sign, also Chvostek sign, pressure on the facial nerve near the tragus of the ear, and this pressure can cause a blinching of the face, and this blinching of the face is characteristic of patient with hypocalcemia. Hypocalcemia treatment treated the underlying pathology, and usually replacement with vitamin D and calcium whenever there is deficiency. And never forget, malabsorption syndrome is one of the major cause of hypocalcemia, like celiac disease. So some patients with hypocalcemia and resistant to treatment, we advise this patient to undergo celiac screen, anti-gluten antibody, anti-endomycin antibody, OGD, and duodenal biopsy, and the treatment is very easy, is a gluten-free diet. Gluten-free diet. Hyperparathyroidism occur in two major forms. Primary, most common cause of hypercalcemia, that autonomous production. Secondary, caused by a chronic condition associated with the chronic depression of the calcium, like patient with renal impairment. Compensatory mechanism will be hyperparathyroidism. Tertiary, rarely occur. Tertiary, when you correct the secondary cause, when you correct the renal failure by dialysis or conservative treatment, and the gland still having hypersecretion. This is tertiary, which is rare. Thank you very much, and I hope you enjoy the lecture.